Or Iraq or Iran. Yeah. Yep. Now that is. Yeah.
Okay, we're live here, so you can go off mute.
All set? All right, we'll call this meeting to order. This meeting and all other meetings of this committee are open to the public. Proper notice has been posted and given to the media in accordance with Wisconsin statutes, so the citizenry may be aware of the time, place, and agenda of this meeting. Right now, we're looking for a motion to approve today's agenda.
Motion.
We have a motion. Do we have a second?
Second. You have three of
It's a
them.
race. Okay, we have a motion and a second. All in favor, say aye.
Aye.
Those opposed? Okay, roll call. We're all here, right? Looking for a motion to approve the minutes from our previous meeting in May.
I so move.
Second.
We have a motion and a second. All in favor, say aye.
Aye.
Those opposed? Carries. Any public comment? Program presentation, tick data.
So our presentation this month is on some tick data. You know, it's been that time of year with ticks, and we've always had, you know, I think if you look, well, Haley will get into the data, but certainly something that we experience here in Waupaca County is our ticks and diseases associated with ticks. And so Haley dug into some of our data just to kind of share, you know, what Waupaca County sees with regards to ticks. And I'm going to pull up her presentation.
Well, I'll just get started while he's pulling that up. So what I kind of did was just pull some general information on ticks. So I'll kind of talk about an overview of ticks, the tick-borne illnesses that we look for and that we keep track of year after year, and then kind of wrap up with just some information on prevention, because prevention is the bread and butter of public health. So we know these things happen, but what are we trying to actively do to prevent those things from happening? One more. Thank you. All right, so in Wisconsin, there are 3 ticks that we are typically watching for. We have the black-legged tick, which is most commonly known as your deer tick. We have the dog tick and the Lone Star tick. Those are the 3 that are typically the reason that illnesses are spread to people in the state. We know they like to live in wooded, tall, grassy areas, so a lot of that is in our county, so they are here. Nearly all illnesses that are spread in our state are from the deer tick or the black-legged tick, and it's usually the adult female or the nymph tick that is spreading those illnesses. Next slide. So there are 8 tick-borne illnesses that we typically watch for and get reported to us. 4 of them are certainly more common ones that we see here in Waupaca County, but just because the other ones are more rare, they're definitely still ones we're keeping an eye out for. So the ones that we're typically seeing are the anaplasmosis, the ehrlichiosis, the babesiosis, and then Lyme disease, of course. So for tick-borne illness data, I went back 15 years and took a look at how many cases we see in our county year after year. You'll notice over that 15 years, there is an uptick. We're seeing more. The last 3 years have been pretty steady, around 150 cases a year. But there are some standout years like in 2021, 2017, and 2011, where it's just a little bit higher. That can be for a number of reasons. It can be related to weather and climate. You know, if it's a really warm winter, the tick season starts earlier, goes a little bit longer. It also, 2020, 2021 could also be maybe attributable to COVID a little bit. 2020, we were in the height of COVID. People probably weren't going to the doctor as much, getting tested. So therefore, in 2021, when things kind of started to settle down, we could have seen an uptick from that, from just people going back to the doctor again, actually doing testing and things like that. So that's number of cases. So that's a count. On our next slide, what I did is I transferred it to rates. So counts are really useful when you're looking year after year within the same population. But when you're starting to try to compare across populations, especially when there's different size populations around the state, a rate is a lot more useful to us to know, okay, where do we stand? How do we compare to those other populations? 146 cases in 2024 in Waupaca County is a lot different than if you're having 146 cases in, say, Milwaukee County, where there's a lot more people. So on this map, what you see is rates on a scale. So the darker the county, the more cases you would expect to see in 100,000 people in that population. So you'll kind of notice, I know it's not the biggest on here, but Waupaca is pretty dark. It's not the darkest, so we're not, up there with our northern and western counterparts, but we're still pretty dark. So it is something that we do see a lot of in our population. The limitation to this data, though, is this is all information for our residents. So what we don't get a count of, and we can't really get a count of, is how many people come and visit here, maybe get exposed to a tick here, but then they go home. And then that's when they start to get their illness, symptoms, things like that, and they get diagnosed with a tick-borne illness. If someone came and camped here for the weekend, they go home, they get diagnosed with Lyme disease, that is a case for their resident county. It is not a case that gets counted for us. So what I tried to do is to get an idea of how many people of our resident cases are actually being exposed here. So is it that we have a lot of ticks here, or is it that our population is also going camping up north and then they're getting exposed elsewhere, coming back and getting diagnosed here? So depending on how these cases get reported to us, there's kind of a subset of different follow-up and investigation that our nurses do. So you'll see that of 146 tick-borne illness cases among our residents, 105 get sent over to us as lab results. So the follow-up doesn't go as deep on lab results. So we don't get as much information about the exposure type. So take those out, you're left with 41 cases that we can dive a little bit deeper into. How were they exposed? So what our nurses will do is they'll give them a call and they'll follow up and they'll kind of try to ask some questions about exposure. Did you travel, or were you always in Waupaca County? So we know of those 41 cases, 46 did not travel. They did not leave Waupaca County. Some of them did go out of county and some of them did go out of state. And so then we try to get some information about tick exposure. Do you remember a tick on you? Do you remember a bite? Do you remember seeing them crawling on you? Or do you have any recollection of having a tick on you? So we know that about a third did know that they got bit by a tick. 2%, they remember seeing ticks on them, but not any that had actually attached to them. 22% had no known tick exposure, and 17%, they just couldn't really say no, definitely not, or yes, I did have a tick. And then from some of those questions and then continuing to investigate, did you participate in outdoor recreational activities? What did that look like? Where did you do that? How long did you do that? Are you in an occupation that you're outside a lot? We were able to see that 51% of those cases, we can really confidently say they were exposed here in Waupaca County. 10%, it was likely that they were exposed outside of our county. 5%, we can pretty much say in Wisconsin. We know they didn't leave the state, so somewhere in this state they were exposed to the tick. And then we have, I think it's just about a third, I can't read it right now, but that we just can't really say where they were exposed. And that could be because we didn't get a hold of them or we didn't get enough information from them to make that deduction. So that's what our tick-borne illness cases look like. That's how many we're looking at. But like I said, prevention is the bread and butter of public health. So what are we doing about that? So the best way to prevent tick-borne illnesses is to not get bit by ticks. So we spend a lot of time talking about how to prevent a tick bite. Next slide. So the main way that you prevent tick bites is personal protection. So, using repellent, wearing proper outdoor clothing, so tucking in your pants into your socks when you can, avoiding direct contact with ticks or not going into tick dense areas. So if you're hiking, staying on the trail, not going into those really brushy areas. And then, of course, there's environmental changes, but we don't have a lot of say over a lot of those things. So personal protection really is your best bet for preventing tick bites. And so what do we specifically do? Obviously, as a public health department, we are not, doing tick checks for people. We are not applying repellent for people, but we're educating them on all of these things. Our nurses are providing that follow-up to anyone who is diagnosed with a tick-borne illness. So again, trying to investigate the who, what, when, where, how, so that people can understand how they acquired that illness. And then they can think about moving forward, how do we prevent another tick-borne illness, either in themselves or family members and friends. And then we also distribute tick kits. So our education can take on many forms. We provide face-to-face education, so we'll go out in the community. You'll see some pictures of our staff at different community events, having booths where we give out pamphlets and brochures and we talk about ticks and tick-borne illnesses. We give out our tick kits, and we're just there as a resource to have that conversation and make sure that our community is aware that ticks are here, they are prevalent, and you can get sick from them. We're also posting on social media, so if we're not seeing people face to face, they're hopefully getting that message through social media and through other methods. And then our big one is definitely our tick kit distribution. So we have distributed 950 tick kits so far this year as of Monday. Our nurses have done a really wonderful job of thinking through building partnerships with different places in our community where that tick risk is higher. So our campgrounds, they are making sure our campgrounds are equipped with our tick kits so that anyone who's visiting for a day or a weekend or a week, that they have access to the materials to prevent a tick bite, or if they do get bit, know what to do when that happens. So I did bring some tick kits for everyone. So if you want one, you can take one. If you want to open one up and take a look at the contents, just to know what that education and information looks like. They're really, really popular right now because we're in the middle of tick season right now, but definitely something we're always wanting to distribute to anyone and anywhere that would like them. And then on this last slide, I did just include some other helpful resources that I think are helpful to any community member. So Wisconsin Department of Health Services does have a tick ID service. So anyone in our state or any of our surrounding states can take a picture of a tick that they find on them or find near them, and they can send it in, and DHS will identify it for you, especially if you're not feeling confident. Is it an adult female? Is it an adult male? And unsure, you can send that in and they can identify it for you. There's the Wisconsin Tick Bite Tracker, which is a good way of keeping track of tick activity in the state and in the region. It keeps track of ER visits related to tick bites. And so you can kind of see year after year and throughout the year of, when are ticks really active? When are people getting bit and things like that? And then the last website is from the University of Wisconsin Entomology Department. They have all sorts of resources on ticks, tick-borne illnesses, things like that. And they just released an app that you can download on your phone as well that provides a lot of those same services. So identification of ticks is, in your community, is tick activity high right now? Is it low? What should you be aware of? What should you be on the lookout for? So again, just things that if you don't want to dig through a website, that app can be really helpful to just have it in your pocket, especially if you are an avid outdoorsman or an outdoorswoman. And that is all. Unless anyone has any questions about ticks.
Do you get your data do doctor's offices have to report it when there's a diagnosis? Okay, but you said something like 100 of the 150 or something like that. When you just get a lab report, you don't follow up on it, but when do you follow up?
So the lab reports, they're automatically sent over to us. So it's not doctors having to input it and send it over to us. We just get the results. And if it's negative, then it gets filtered out. But if it's confirmed, then it's something that gets tracked for us. But then yes, the follow-up is different. I can't say that it's nothing, because I do think our nurses still do reach out, but the questions that they ask are different if they are reaching out to them. So the other ones that come through, maybe it's, it comes through and we have to do a little bit more legwork to figure out, is this a tick case or not?
Oh, okay.
And then that's where, some of those questions filter in. Okay, well, do you know that you've been bit by a tick? Do you participate in outdoor recreational activities where we can, reasonably say that, okay, yes, it is likely that it is a tick and a tick-borne illness. So
So-
it just comes through different.
And so providers know this is one of the mandatory things they have to report, kind of like STIs and things like that.
Yes, so
Okay.
tick-borne illnesses, I think almost all of them are category 2.
Correct.
So they just have to report it through the WEDS data system, whereas some of the other diseases, they have to call us or they have to notify us right away because it's got a high probability of spreading to other people. So they're categorized in different ways and then they get sent over to us in different ways.
Any other questions?
I take it it's how to remove and so forth, but does it go beyond that if you think that the head of the tick is still in it?
I
That's
don't-
advice on where to go from there.
Yes, on the DHS website, there is, I don't know that if in that packet it would say, go to a doctor, don't go to a doctor. But it does provide some resources on where to go to figure out, should you go to the doctor?
Okay. You're up, Jed.
All right, so for our general board business, our first item is Wisconsin's WINS grant. This is a grant that we recently agreed to take on. It is not a new grant, it's been around for a while. It's a tobacco prevention program. The state had reached out to us and asked if we were interested and had the capacity to take it on. Previously, in our county, the activities for this grant were done by a coalition out of the Fox Valley. I did reach out to them and talk to them a little bit on where they were at and kind of talked to some of our staff about capacity to be able to do this. And I think with our community health educator, it fits into her role and she has capacity to take this on. It's not a major program. We're receiving just over $3,600 to take on the program. But I think it's a really good program. I said it's been around for a while. It's tobacco prevention. It does a few things that I think we're good at and things that we want to continue to get into in our community. And there's 3 components of it. There's media outreach, there's public outreach, and then there's also compliance checks. So public outreach and media outreach, we're required to do at least a minimum of 5 public outreaches and then 4 media outreaches. Those are really easy for us. We do a lot of media outreach already on social media, radio, newspaper, and that's just about tobacco prevention, tobacco education, and maybe a little bit about what we do with the compliance checks, which I'll get into. Public outreach is the same thing. It's providing education on tobacco health related issues. Again, the compliance about who selling tobacco to minors, those type of things. And then there's the compliance checks. So compliance checks are basically you have a minor go into a retailer that sells tobacco products and see if they'll sell to the minors. They card and deny the sale or if they will sell to a minor. So the program basically consists of us recruiting some 17-year-olds that are willing to go in. All they have to do is ask to buy some tobacco products and then leave, basically. And then we just keep track of where sales have happened and where sales were denied. And anybody that denies the sale, we issue positive reinforcement. Thank you. We had someone come in and you carded and you did not provide a sale. If there is a sale, then we provide some more education, like, hey, just, you know, we had someone who came in and you sold to a minor, and then provide some education on what the laws are and more education. And we also communicate the results of all of our checks to local law enforcement. So this is countywide. We have to do a minimum of 47 compliance checks for this. You can typically do that in a day or two. Just go through the county. We'll go to all municipalities and townships that have retailers that sell tobacco products. And there's a certain percentage of, you have to do so many bars, taverns, other places smaller places that sell tobacco, and then a larger percentage of like your convenience stores, your gas stations that probably do the majority of tobacco sales. So that's basically the gist of the program. I'm looking forward to it. I think it does a few things. It involves us a little bit with, you know, tobacco prevention and health. It's a little bit more media and public outreach for us, and it also we'll have a connection working with the youth too. So, you know, we can work on this program, and maybe it gets us to work with some youth on other programs that we're always looking for input from, you know, different demographics, especially that younger demographic and some issues. So we'll be starting that this year, and again, it's only 3,600, so it'll certainly cover our costs. It's not a major program, and like I said, even the compliance checks, I don't think will take too much resources, and I think we can fairly well integrate it into our community health educators role. So, any questions on that?
Repeat offenders, do we have any policy on?
We'll probably, we don't have, we'll be getting some of like the guidelines and toolkits for the program for how to handle repeat offenders. I think there's probably a little bit more education, or, you know, at some point, if it's a continual repeat offenders, we can work with law enforcement and see where they would want to go in whatever direction they might want to consider.
Do they also do that compliance checks, or is it just you guys? Like, does law enforcement also?
I don't think they do. I think
Like
basically this
bigger things to do.
program always has, and the law enforcement has always gotten the report from the coalition that had done it previously too. So they're aware of the program. Any other questions?
Test strip grant.
So we recently awarded a test strip grant, and essentially the state had this available for counties to apply for. We're certainly always looking for supplies for our vending machines and any other outlets that we have for test strips. So we received 4 cases of fentanyl test strips, which holds 100 strips in each case, and then 100 fentanyl test strip kits, which includes a few of the items that it takes to actually do the test, and then xylazine. We have 8 cases of xylazine test strips and 200 xylazine test strip kits. So Haley wrote for it, and we were awarded it. Just some more tools in our toolkit to provide to the community to combat, you know, fentanyl and xylazine.
Those are going in the machines?
Yep, that's the plan, is to put in the machines. And to date, so we did have some fentanyl test strips that we had in hand before. We have distributed 26 kits so far from the vending machines, which is about 103 test strips. So we see people utilizing them. Any other questions on that?
And again, going off subject just a little bit, but those machines, are they doing what we're I mean, are they being used? You know, I know initially they got used a lot, but then, so I mean, are they functioning and doing what we want them to do perfect?
I pull the data every Monday, so as of through Sunday, so they opened in January and then through 6/22, I think, we've given out almost 800 items in the machines, and they've been accessed by 36 different zip codes. So we are reaching actually beyond our county as well with these items. So there are people coming in from Shawano County, Outagamie County. We've had some Milwaukee County, Brown County individuals, all Portage County even. So they're being utilized mostly by our community members, but even reaching beyond.
So they put a zip code in to identify what county they're from.
Yes, so that's how they access the machine as a zip code. So some counties have people call in to get a 5-digit PIN. We felt like that was going to be a barrier, so we asked people their zip code to identify where they're coming from and access the machine, and then we do ask for age. So they just type in what their age is. Some people obviously lie because it'll be like 100 something, and then there's even like 4. There's a couple 0. There's some babies that are using the machine apparently. But we are trying to collect, at least some demographic information.
Do we know then, if, let's say somebody from Portage County puts in, do we know what they've taken out? Oh, so, okay.
Yep, so I can look at it more detailed line by line of figuring out, okay, did they take first aid kits? Did they take fentanyl test strips, or what they're taking?
Like you're saying, I'm thinking about the tick kits too. So if somebody from Portage County comes in and grabs a tick kit, well, there's probably a reason we did that. So I mean, there's more data that can help you with your report. So that's all I'm thinking. Perfect.
I used it for a tick kit just to see how it worked.
Perfect. Yeah, the tick kits are definitely the popular item last month and this month. But it's interesting to look month after month and kind of see how it trends and what the popular items are each month.
We initially got not we, but the department got grant funding for a couple years for that, and then or something, correct me if I'm wrong. Then is there a plan to keep that going? Do you have to request more funding, or how do you keep up with it?
Yeah, so the initial grant funding was to purchase the machines and to get some of the startup items for the machines. Annually, we will have to pay some sort of subscription just so that I can keep getting access to the online data system where I pull all the information from. And then the wireless component because it needs to have internet. So we pay for that annually, but otherwise everything in it is pretty much grant funded in other ways.
And the state has had some grants, follow-up grants to resupply and maintain. We'll see if they do again. Usually is around, I think, the fall or early fall and the summer when they had those available. Not sure if that's going to be available again, but as far as the supplies too, we did get an approval from our opioid settlement funds to continue to purchase Narcan to supply. And then grants like this that we look for to continue our supply with test strips. We use a mini grant we get for communicable disease to make the tick kits. So we're just always looking for little pieces of funding that we can identify to use for supplies that we put in there. As things change, as things come up, we'll probably have different items available in the vending machines. So
The biggest cost initially was getting the machine.
right.
That's cool.
The cost of the machine.
And those are located, just as a reminder, first floor of the courthouse, and then at Compassionate Connections, in their entryway, or they have a 24-hour access entryway. Compassionate Connections, I believe, is on Main Street. I forget the exact address.
143 South Main Street.
He's got the address down.
So has usage of the vending machine at the courthouse kind of dropped because of construction?
I almost want to say you would know, but is now that I would almost think
People
that
are
it might
forced to walk
it
by
might
it now.
pick up because of where it's located
Right, that's true.
and where people are being rerouted. They're going. Everybody who's coming in for any type of service is going to see it. So.
Yeah, last month was, aside from the first month it opened, was the busiest that it's been. The courthouse machine does get more vends than the one in Compassionate Connections, but that gap has been closing, but they've also been having lots of events and things and doing lots of media outreach and things about their machine as well. So it's closer, but the one in the courthouse definitely has been used more.
Okay, HIV Partners Services Program.
So this is a program that I didn't have a whole lot of knowledge about until this last, I think, a month or two ago, when Outagamie County reached out to us. I was not aware that we even had this agreement. It was something that was in place before I was health officer. But Outagamie County had actually agreed at some point with us to take any cases, HIV cases, Waupaca County cases, and they would provide the support on follow-up to cases. And part of that support is, going over health information related to the diagnosis, but also providing partner services where they will offer to contact partners for anybody that had been recently diagnosed with HIV. And so they had trained staff. You have to take multiple trainings to be able to provide that service. Outagamie had reached out to us and said, hey, we've been doing this for a long time for Waupaca County. Would you be interested in taking it back? So, we looked into it a little bit more, had a conversation what it all entailed. Again, HIV is a reportable communicable disease, and something that, just like a lot of our other communicable diseases, that is required to be reported to the local health departments, and then for us to provide some follow-up. And so we learned a little bit more about the program. They mentioned it's maybe on an annual basis, we average 1 to 2 cases, so it's not a big workload. So we have agreed that we will take that program back and start providing that service. There is some reimbursement for it as well that the state provides. So we're still getting some information on how all that works, but we'll be taking that program over. So just another program that we'll start integrating into what we've been doing. Outagamie County didn't do that for anybody else, and so I think they were looking for us to get back into it, which we'll be able to do. There are some other counties, like Dane County does provide support to some of their surrounding counties to do it, and it's just a matter of having the proper training for staff to manage the program, and our staff are going to be able to take that training and be able to provide the service. So we'll be doing that going forward as well.
So if I can ask, when did we get into this agreement? How long ago? I mean, and and then why did we get into it? Is there any?
I'm not sure. When it happened. I'd have to dig a little bit to see if there's even an MOU on that. I think because we had so few cases, Outagamie, higher population, probably works with more cases, had trained staff and is able to do it. When you have fewer cases, it's a lot of training to be able to provide that service. I'm guessing and Outagamie was willing to do it at that time. I'm guessing that's why we got into the agreement. That's been great that they've been doing it. But when they reached out, I'm like, I don't know what you're talking about.
Probably in the mid-'80s, I would think,
Yeah.
when it really
started?
yeah.
So
But
that's
then, and then if it is only a few cases, why all of a sudden do they just want to get rid of it? Is there more behind the scenes, or?
I think they were just going through all their programs, and they kind of were like, well, we're taking a look at this program and wondering if they've been doing the service for Waupaca County. Is that something Waupaca County at this time would be interested in doing? And so I was like, yeah, I think that's something we can certainly, work on, and we can manage that, I think, on our own.
Probably like any other county, workload.
Yeah.
Depending on staffing at the time. You think we can do it?
I think we can.
It's just interesting how stuff like that happens out there, comes back.
Any personnel information?
Nope, no updates there.
Your general updates?
Not a whole lot to add, just mention that, our strategic plan, we, are working on the implementation. We, within our staff, we developed 3 work groups for, each goal. And so we're gonna start implementing that. So we've been working on that in the last, few weeks, but that's really all I have.
Any supervisor reports? Anybody go to any conferences or anything? There's one in the fall for us. I think it's in the Dells this year. Highly recommend going to that. A lot of good information. Breakout sessions.
Do you know when it's at or when?
September. Yeah. Just get a hold of Christy. She'll be able to set you up. Next meeting is June 25th. Oh, what the? July.
That's right, I was gonna say we need to amend the agenda.
Oh, yeah.
Should be July.
Yeah,
That's the fourth Wednesday for July. Is that what you would like to have?
Yes.
July 23rd? July 23rd.
All right.
Do you need like a motion and stuff to amend that?
8:15.
Just fix it.
We just, yeah, we just fixed it. And I will just read whatever's on the sheet, so. Looking for a motion to adjourn. We have a motion to adjourn. All our business is finished.